And I mean, we have seen some decisions taken about some major changes for our local health services. And you're aware that what I've done is I've written out to my constituents, particularly in the area around Queen Mary's or close to it, and asked them a number of questions and asked them to come up with questions for you to find out more about what's happening here, because this is the biggest change we've seen so far. I think you'd agree with that.
Absolutely.
Yeah. So the first one really is people are concerned about the hospital itself. There's a lot of rumours out there. So the blunt question is, will Queen Mary's Sidcup close?
Absolutely and categorically not. We have a 5-year strategy for healthcare in South East London, and Queen Mary's is an implicit part of it.
So, having said that, then, can you just briefly explain what the role of Queen Mary's Sidcup will be in that 5-year plan?
Yeah, very, very much so. One of the things that we consulted on in the Picture of Health, and one of the things we were very keen to have for this area, is a separation of hospitals that delivered emergency, unscheduled care from hospitals that delivered scheduled and planned care. There are a whole range of reasons why that is, of which the most obvious is the ability to screen patients before they come in. But one of the problems with hospital-acquired infections, if you're running what the NHS calls a hot site, where you have both A&E and elective treatment, is all your elective patients are pre-screened, and if they have a condition, you can treat them accordingly. People who come in on ambulances, by their very nature, can't be pre-screened, and so inevitably there will be a risk of bringing infections into a hospital. If you have a hospital that specialises solely in elective treatment, which is the purpose that we want Queen Mary's, we can absolutely guarantee that Queen Mary's will not have hospital-acquired infections, because everybody that comes into that hospital will be pre-screened and treated accordingly. So it'll create a much safer environment for the delivery of elective care.
And in addition to that, people will be operated on to a timetable that will be less prone to cancellation.
Because that is the other problem of when you run both emergency care and elective care on the same sides, and this has certainly been the case of some of the problems we've had at Queen Elizabeth over the winter, where we saw an increase in emergency demand. People who had planned operations, people who had arranged to go in for routine elective treatment, had their operations cancelled before they went in. And of course there's always the danger that they can be cancelled after you've gone in, because if an emergency arrives by ambulance, that emergency has to be treated. A cold site, a site that only has elective and planned care, will never need to cancel an operation because an ambulance has arrived.
So in layman's terms, if you've got a planned operation to say replace a knee, and it's taking place here at Queen Mary's Sidcup, it should go
it should happen
on time,
on exactly the date that you expect it to happen, and in an environment which we can guarantee will be a safe and secure one.
We're already seeing new services coming into Queen Mary's that haven't previously been available to the people around here. In the next month, we're going to be beginning to treat patients with a new renal dialysis unit. Previously, people had to travel fair distance to get that treatment. We're looking at new services all the time with this process. We are already bringing in a new stroke unit, a specialist stroke unit, to the neighbouring Princess Royal Hospital. That means that patients from this area who previously didn't receive specialist stroke care will be able to. So there's been some significant gains already, which is very promising.